Hello, I'm Hartford Healthcare's Rebecca Stewart, and I am thrilled that you are taking part in our Ask the Expert series. We have Dr. Andrew Salner with us today, the medical director of the Hartford Healthcare Cancer Institute at Hartford Hospital, what many of you know as the Great Cancer Center.
Rebecca,
so
greetings.
Thank you so much.
My pleasure.
You may have just seen a piece that we did with Channel 3 talking about survivorship, and specifically, I do want to make sure that folks know we are previewing a very special survivorship event. This is the 28th annual survivorship event, and there are more survivors than ever before. This is an incredibly hopeful time.
It is indeed. There are now about 15 million cancer survivors in the United States, and that's really a tribute to early detection and improvements in treatment, which now means that the 5-year cancer survival rate is about 65%, which is wonderful news. And as that number of survivors grows, it's wonderful and inspiring, but it also creates challenges for us as cancer providers and the medical community to ensure that we take care of the special needs of those survivors.
So that is fascinating to me, and that's something that we do want to talk about, because when it comes to survivorship, all of a sudden we have these amazing lives saved, and yet the journey's not over.
Correct. Interestingly enough, cancer survivors, as you know, have a risk of a recurrence of their cancer. So we have to provide guidelines for them for surveillance. Cancer survivors have a risk of getting another cancer at some point in their lifetime. So we have to provide some guidelines for them for screening. Cancer survivors have a risk of late effects of their cancer therapy. And so we need to inform them and their primary care physicians about what guidelines need to be followed to monitor them for any late effects, for example, on their heart or lung tissue or other tissues from the treatment they've had. And finally, and most importantly perhaps, is that cancer survivors have gone through a traumatic journey. And in order to recover, they need to do things that will enhance their physical, spiritual, psychological, and emotional well-being. And that means lifestyle interventions like exercising, because we know that physical activity of at least 150 minutes per week, Rebecca, exercising a minimum of 5 days per week, reduces recurrence risk, in some studies by as much as 10 to 20%. Maintaining a good diet, not drinking too much alcohol, no tobacco use, and trying to get close to ideal body weight as a way of helping to reduce their risk, not only of subsequent cancer, but also of other major issues like diabetes and heart disease. And at the same time, we try and offer supports for patients that can help uplift them. So those supports might be support groups.
Sure. We
have many. Or it might be integrative medicine, where we offer Reiki or acupuncture or massage therapy, or ways of helping to cope with stress and stress reduction techniques, all of which are really designed to help people during that transition from active therapy into their survivorship.
And I love the idea that integrative medicine, all of that you're sort of talking about, has really become mainstream. It is a part of therapy.
Yes.
You're doing a lot of research with your partners at Memorial Sloan Kettering.
Yes.
Tell us about that.
Yeah, my particular research, we have many very wonderful and novel research trials open with Memorial Sloan Kettering that offer Connecticut cancer patients access to unique new therapies. It's very exciting. My own area of research in cancer survivorship is working with my colleagues at Sloan Kettering through a study that's been funded by the National Cancer Institute to look at how we support patients who've had head and neck cancer. Those cancers in the throat and mouth, for example, are particularly challenging for us because the treatment that we use, whether it's surgery or chemotherapy or radiation or a combination of them, frequently result in patients having long-term effects of the treatment. For example, a dry mouth, which may make swallowing difficult, or alterations of speech or appearance, or functionality in terms of their neck or tongue. So a lot of our effort has been really designed to try and study what those long-term issues are and to try and provide support for them. So our research really provides a personalized survivorship care plan for those patients, where we find out from the patient what their issues and challenges and problems are, and we develop a personalized care plan that enables us to have some strategies for that particular patient. That care plan consists of a summary of their treatment, so the patients and families know exactly what they went through, what the disease was, and what a stage was, and that sort of thing. But it also has a care plan which talks about those 4 domains that I mentioned: surveillance, wellness, screening, and late effects, so that it serves as a blueprint for the patient and for their primary care physician, and in the case of head and neck cancer, their dentist or oral surgeon, so that all of those people who are involved in wrapping themselves around the patient and helping to support them will have a plan for how best, using evidence-based strategies, to help them return to functional and normal life again.
How different is this from when you started all those years ago compared to now? Did that exist, that sort of whole picture?
You know, I think we always knew that survivorship was an important part of the cancer journey and that we needed to address it, but we never really had the science to know how to do it. We did offer some support programs for patients episodically. We did tell patients to call us if they need us, and we saw them for periodic visits, but we never really had as formalized a process for really helping them to make this transition and for taking this moment when patients complete active therapy, which I sort of call a teachable moment in a way, because patients feel vulnerable. They've been coming every week or every day for treatment, and all of a sudden, boom, we've pulled the rug out from under them and said, goodbye and have a healthy life. We'll see you in 6 months, or we'll see you in 3 months, but go to it. And patients are worried. And it's a time when we can really help support them and give them some good strategies.
Excellent. One of those strategies we've been hearing a lot about is something called yoga for cancer. And yoga for cancer is something that you tell us a little about that. And it looks like we have some questions that I'm going to take a peek at. But tell us a little about yoga for cancer.
I mean, we know that yoga is a great program in general because it addresses sort of both physical and psychological and spiritual needs. So from the physical standpoint, it helps cancer patients recondition because many cancer patients during their treatment get deconditioned. It helps them with their balance because some patients with neuropathy or other medical issues have issues with their balance. Because it's anti-gravity, it may help them with their bone density. And in addition to the physical issues, the spiritual and psychological issues, it helps them sort of look within and have a moment of peace and meditation and kind of a prioritization perhaps of their life. So I think that's really important. And it helps, the breathing is so important in yoga. And that's one of the strategies we use to help people working with stress, to de-stress, to learn those breathing techniques. So I think yoga in general is great. The Yoga for Cancer program was specifically designed to help provide for cancer patients, and it's done by a cancer survivor, yoga poses and strategies which really will help cancer patients deal with their kinds of issues. It's new. We're the first place that it's really being tested and studied. We're so grateful for a grant to help support this effort to really see if this helps cancer patients. We will study them during their yoga sessions and then for a period of 1 year after to determine how it's helped them in their life and maybe whether it's made them yoga practitioners even beyond the sessions itself.
I'm eager to see what that turns out. Now, we do have an interesting question about colon cancer. A lot of recent reports talking about colon cancer, specifically in that younger population.
Yes, yeah.
What are your thoughts about that? That's something
it's a bit scary because we know that colon cancer occurs in younger patients. And certainly Katie Couric's husband is a great example of somebody in their 30s who was diagnosed. And we do encourage colon cancer screening to start at age 50 or actually to start at age 40 if you've had a family history of colon cancer or of polyps. Mm-hmm. The question is, now that we're beginning to see some incidence of colon cancer in younger people, for example, in their 40s, the question will be, do we consider changing those guidelines at all? And the screening for colon cancer is not completely simple. It's a little complex. Colonoscopy is the gold standard, but there are other screening techniques as well. And so I think right now the cancer community is getting their arms around what the new data shows and the new research shows in terms of, we don't know why, it's what's causing it. It's not in necessarily just in people who have a family history, it's in people who do not. Right. We think that there may be some environmental or dietary factors which may contribute. Those are being studied now. But I think the cancer community will try and get their arms around it and determine whether we need to change our screening guidelines. They haven't changed yet, but stay tuned.
Absolutely. And before we go, we do want to remind our viewers and viewers in the future that we have a very special event coming up. It is September
9th, 9:30 to 11 a.m. at the Hartford Downtown Marriott. It's our Celebrate Life event for cancer survivors and their family members. You don't have to be treated at Hartford Hospital to come to our free event, which includes a breakfast and some great talks from invited speakers. It's a morning of inspiration, humor, and fun and love. It's really great. And please feel free to call 855-HHC here, HERE.
And that number, believe it or not, is right at the bottom of our screen.
Wonderful. To sign up for this great event. We would love to have you and your family join us for the event and partake. We'll hear from Helen Gray. And we'll also hear from Colin McEnroe, noted columnist and radio personality from the Hartford Courant and WNPR, who will talk to us a little bit about sort of the intersection of humor and hope and what that's all about. So I think it's going to be a great morning.
That's great. And there's certainly, there are a lot of folks who know you got to have humor along the way. And
we would not be anywhere without our sense of humor, Rebecca. Imagine going through the stress of a cancer journey and all the stressors on the patient and family without our sense of humor. Humor saves us.
Absolutely.
Really
and
important.
As does hope.
As does hope.
Absolutely. So hope and humor, a great theme. Thank you so much for being a part of it. Thank you for watching. This has been Ask the Expert on Facebook Live. I'm Rebecca Stewart.